And actually, there's a function for all the different kinds of thoughts we have about the present, the past, the future, liking, not liking oneself. That's all normal. But to induce kind of a psychological flexibility, a repertoire of skills that allow me to be with all that mental content, not be subjected or caught by that.
Hi, I'm Valerie Hoffman, and I'm joined here today by Dr. Philippe Goldin. Philippe is a professor at UC Davis and leads the Clinically Applied Affective Neuroscientist Laboratory. His team is currently doing research on brain networks that differentiate different types of emotion regulation strategies, the neural basis of psychopathology, and the brain and behavioral mechanisms of therapeutic change during cognitive behavioral therapy, which we'll refer to as CBT, mindfulness-based stress reduction, and also compassion cultivation training in adults with anxiety, depression, and chronic pain disorders. Dr. Goldin, welcome and thank you so much for being here with us today.
Thank you for inviting me.
Yes. So much of your research focuses on how different clinical interventions can affect how we feel. At a high level, can you define and let us know a little bit how mindfulness meditation, compassion meditation, and CBT impact people's mood and anxiety?
Gladly, yes. So, um, overall, what's important, one thing that's important to understand is that all these different forms of interventions are ways of training skills. And one of the primary skills that we train is emotion regulation. And what I mean by that is specific strategies for identifying different emotions and then being able to up or down regulate their intensity or their duration. So, for example, cognitive behavioral therapy, one of the core components of CBT or cognitive behavioral therapy is to teach people how to identify emotions and to use cognitive reappraisal or cognitive restructuring, which is really in one way is taking perspective. So being able to see your emotion from many different viewpoints and being able to reinterpret the context or the meaning to be able to down regulate the intensity of, say, a negative emotion of anger or fear or sadness, so that you can have your mind can become a slightly more flexible. In mindfulness meditation, and under the word mindfulness, there are many different techniques that can be used to train the mind to slow down, widen the view, actually observe what's happening with less projection or overlay, and bring a sense of curiosity and acceptance, an active acceptance of, oh, this is what's happening, whether it's pleasant, unpleasant, or neutral, and kind of a fierce courage and trust that even if I don't do anything active, what I'm experiencing this moment to the next moment to the next moment is impermanent, transient, changing of its own accord. So it's a totally different form of working with one's mental content than, say, for example, cognitive reappraisal, where you're actively using language, logic, thinking. Compassion practices, and there's a whole set of those, just as there's a whole set of mindfulness practices, are more advanced practices, I would say, that get one to begin to shift from the focus is on me, my feelings, my emotions, my worries, to what are others feeling, going through? How can I generate a wish, an intention to be of service to others? That by itself is kind of a form of reinterpreting or reframing that allows me to get out of my own sticky mind, so to speak, and to become more interested in either a single person, a set of people, or even all living beings, and understanding my relationship to all of them. And suddenly I'm not alone. And it's the story, the narrative is not just about me. So that's a very brief uh, unpacking of some of the things that are similar and different in these different modalities. Yeah.
Yeah, that's great. So if you had a patient come to you
Mm.
with some depression and anxiety, how would you determine whether to start with CBT versus mindfulness versus the compassion training?
Oh, that's a great question and a complex one. And
Yes,
oh boy, do we wish we had the holy grail of some type of assessment that would say, should this person do physical exercise
yes,
or a antidepressant or anti-anxiety medication plus
yes.
mindfulness? We don't have that level of specificity in clinical science yet.
Okay.
We hope to get there. But having said that, in general, um, probably beginning with some cognitive behavioral therapy is always a good start, with or without medication, depending. So essentially, if it's very severe anxiety or major depression, maybe medication is warranted to start with, just to kind of bring the person back to down intensity down a little bit,
Mhm.
because really then you want your brain and mind resources to be available to then really do the work of learning, what does it mean, how do I identify different emotions, how do I take perspective, how do I get caught or use language or interpretation to regulate my emotions as opposed to be regulated by them,
Hmm.
and also to shift the perspective that having emotions of any kind, positive, negative, wonderful, scary, that emotions are sources of information, and that in and of themselves, emotions are actually a gift because they're immediate feedback on how I'm doing and how I'm relating to others right this moment.
Hmm.
But then the trick is, if I'm very anxious, I may not want to have that emotion, or I get caught in anxiety or fear or worry. Or if I'm depressed, I might have this deep, heavy sadness and I get like stuck in the mud. So
Hmm.
cognitive behavioral therapy helps to clarify some of those relationships. So I would say probably cognitive behavioral therapy is a really good ground to start with.
Mhm.
And then the set of practices under the rubric mindfulness. There's like 30, 40 different practices, and only a few of those are actually taught in the West. But these are sets of practices that are used kind of like tools to explore, how does my mind get stuck?
Hmm.
Or how does my mind release from habits? So I think that's a bit more subtle, very complementary. So ideally, I would say cognitive behavioral therapy first,
Mhm.
then some mindfulness training, because that's like a next step down in the what I call the inner archaeology of working with our own mind.
Okay.
And then compassion would come last, because that's more intense and deeper levels of practices, be it
Interesting.
self-compassion, compassion or kindness towards the self, and compassion towards others. And I would do that later, after the mind, after one has learned how to stabilize the mind enough to be able to do deeper practices. And then there's many other ways of training the mind that go deeper and deeper, but I would not start with those.
Okay.
Yes.
Okay. Fair enough.
And yeah, and remember that for when we what we call depression and anxiety have about a 60% overlap in symptoms.
Yes.
So you often see them together. And if you're working with somebody long enough, you often see the depression and the anxiety, because they kind of ride together.
Yeah.
And some of the core mechanisms that drive both, if you can hit that core mechanism, like emotion dysregulation or distorted views of the self, you can really alleviate the anxiety and the depression.
Yeah.
Yeah.
So one of the kind of overlapping things that people with depression and anxiety tend to have are some negative self-beliefs.
Yes.
Um, so how do they impact our mental health, and how can they be shifted using these techniques?
Yes. So that is one of the key enterprises of any form of psychotherapy is really to identify what are my patterns of negative beliefs, and specifically negative core schemas or negative core beliefs. And in fact, there's research showing there's probably like 20 to 30 different kind of negative schemas, and most of us gravitate towards some subset of those. So one of the things you can think about is, how do I begin to befriend those beliefs?
Mm-hmm.
And what I mean by that is that this is just a thought. So from a brain perspective, we know that there's a language network of three different brain regions on the left hemisphere for people who are right-handed, for most of us. And that those neurons, that neural circuit produces thoughts. And from research, we know that there's probably 4 to 5 negative thoughts to every 1 positive thought. So this is just a ratio that has been built into our biology through evolution, and probably for a good purpose of protecting ourselves and being a little bit hesitant and being careful. But when that increases too much, then we spend a lot of time in negative thought land. Mm. And that can become harmful for our relationships with others, with ourself, with our vision of ourself into the future. So that's why it becomes important to be sensitive to, when are my negative thoughts at such an intensity or frequency that they're really interfering with the quality of my life. The goal is not to get to zero, because then we would not be human.
Right.
Okay. I mean, let's be real. That's not the goal. But if you can begin to, right, we're not robots. And actually, there's a function for all the different kinds of thoughts we have about the present, the past, the future, liking, not liking oneself. That's all normal. But to induce kind of a psychological flexibility, a repertoire of skills that allow me to be with all that mental content, not be subjected or caught by that. So there's, one way to work with the thoughts is to go, this is simply my mind and brain doing what it's supposed to do.
Yeah.
And a negative thought will only last as long as I give it space.
Right.
So even if a thought arises, if I do nothing, in fact, this is a good experiment, my mind is going to move to something else. That is the nature of the mind. When we have anxiety or depression, my mind gets stuck. Yes. I like to call it sticky glue or crazy glue, right? Crazy glue. So all of these skills about learning how to work with the mind, with emotion regulation, those are like WD-40. Mm-hmm. They loosen up the murkiness, the grit, so that you can actually see reality, relate to the contents of one's own mind in a slightly more easy, flexible manner. But again, the goal is not to go to zero. The goal is to be able to sit with, embrace, befriend anything that arises in the mind.
Yes. Yes.
The good, bad, and the ugly.
Yes. Lovely. So you just said the word experiments. Can you, we know you do a lot of research on these techniques. Can you walk us through one of the emotion regulation techniques used in?
Sure. Yes. So let me contrast reappraisal, what's called cognitive reappraisal versus acceptance, for example. So say what I would do with you is I would have you write some autobiographical stories from your life of painful, like social situations or anxiety-inducing situations.
Okay.
Then what I would ask you to do is to extract what are the beliefs you have in your mind, ringing in your mind, when you imagine yourself in that situation that you had either last week or last month or years ago. People are really good at generating those negative self-beliefs.
Yeah.
And then what I would have you do is I would have you I would tell you, I'm going to present you with your own autobiographical story, narrative, your story. And then when you don't even know, unexpectedly, I'm going to have flash your own negative self-belief. At times, I'm going to ask you just to notice your mind's reaction to that belief. I'm not okay the way I am. Mm-hmm. People think I'm weird, et cetera, et cetera. We all have our favorites.
Yes.
Other times, I'm going to ask you to reframe. How can I think about that thought, reinterpret it in a way that reduces its toxicity,
Mm.
its intensity. So, for example, um, um, other people think that I'm really strange or awkward or socially awkward. Then I might go, oh, that's a thought. I don't feel that way all the time. That's not 100% true. Wait a second. Last week, my friend actually said that she enjoyed spending time with me so much.
Mm-hmm.
Well, that means that I'm not always socially awkward.
Right.
And even when I have the thought that I'm awkward or anxious, that may not be the way other people actually see me. So suddenly my intensity starts to go down, my respiration becomes more calm, my skin conductance goes down, my heart rate goes down, my amygdala and maybe insula, their brain activity in those brain regions starts to decrease, and I start to experience slightly more calm even when I'm having that thought.
Nice.
So that's a very active language, logic, disputation, challenging, transforming mode.
Right.
Completely on the other side, a kind of a radical emotional acceptance mode, form of emotion regulation, would be observe. So I'm not okay the way I am. People think that I'm really awkward. And what I do is I simply observe without any intention to change, challenge, transform, no language, logic, simply noticing any pattern of reactivity. Sitting with that, trusting, having first person experience that even when I don't do any active challenging or change, it will change by itself.
Fascinating.
That is not intuitive.
No, it doesn't sound it.
However, it is not intuitive. Some people may think that's passive,
Uh-huh.
but in fact, it's a very powerful, active stance to the experience of my own body and mind. But then when I have the direct experience that when I don't challenge anything, my any pattern of reactivity that I'm having, physical and mental, will change in and of itself. And when I have the direct experience of the impermanence of any pattern of reactivity, i.e., acceptance, mindful acceptance, expanding the field of view acceptance, that is far less effortful than cognitive reappraisal,
Mm.
easier to implement,
Mm-hmm.
and potentially more transforming. And
Interesting.
it's a completely different mode of relating to one's own moment to moment experience. And one is not better than the other. And in fact, if you were going off to work on your own mind, it's better to have more tools than just one.
Yes. Yes.
So that's a concrete example of two different kinds of emotion regulation techniques or strategies that we train people to use, and then we begin to see their effect on their behavior, their belief about themselves, and the brain networks of attention and cognitive control.
So fascinating. So fascinating. Well, I've learned a lot, and I thought I already knew a lot about these topics. But what would you say your take home message is today? What do you want the audience to remember from this video?
Yes. The fact that our brain mind is flexible, organic, modifiable is incredibly hopeful. No
Yes.
matter how stuck I think I am, and I've had my moments of feeling blue, down, depressed,
Mm-hmm.
or anxious, like everyone else,
Yep.
and then knowing that there are tools and methods for alleviating the intensity of depression and anxiety. That that's based in our brains, our evolution, and that's incredibly hopeful.
Yes. Yes. There is hope. Well, Dr. Goldin, thank you so much for being with us today. I hope everyone learned as much as I did, and we're really grateful for your time.
Thank you. Thank you.